Welcome back. In this next segment, we talk to the experts at Touro Infirmary about how they are treating Parkinson's disease through physical therapy. Watch this.
In 2006, I was diagnosed with Parkinson's by a physician here at Touro. And I proceeded to follow his instructions, and part of those instructions were to become part of a physical therapy program. And so I began then, and I have continued since. But about a year ago, or maybe a little longer, I entered the LSVT program when I heard from Lynn Lee, who is here on the staff of the speech therapy, that she had found this program for Parkinson's patients. So I decided to participate in it. It is a 16-week program, and it works where you come in. It can be worked as a 14-week program, but it can also be extended. The time that you spend going through the exercises is one that you learn enough to continue it for the rest of your life, because it works.
LSVT therapy was the outgrowth of what some speech pathologists did when approached by the family of Lee Silverman, an individual with Parkinson's. Her family could not understand what she was saying, and they wanted to be able to understand her. Traditionally, speech therapy had focused on Parkinson's patients, but it was not successful. They were able to affect some change in the person's speech, but it was not long-standing. It was very short-term. So the developers of LSVT decided to investigate and do some research and try to figure out what can we do to make the results of speech therapy last longer. And what they determined was that let's focus on one thing and one thing only: loud. Don't tell a person to take a deep breath. Don't say open your mouth wide. Don't say exaggerate your lips. Specifically, speak louder. One of the problems with individuals with Parkinson's, chemically in the brain, the person's perception starts changing. They think that they're speaking loud enough, but they're not. They think they're moving big enough, but they're not. They don't realize that they are not. And they think that their spouse or their family member or whomever has lost their hearing, as opposed to they're the ones that have affected that are changing.
Parkinson's disease is basically, it's a progressive neurological disorder. And what it is it kind of affects the area or the region of the brain that controls movement. And so what happens is people with Parkinson's have difficulty with their motor or their movement skills.
The exercises are not that difficult to do, but they are important to do. And the therapists are encouraging of what has to happen. In the loud program, I learned to go ah, and in the big program, I learned to take steps not 1 foot apart, but 3 feet or 4 feet, as big a step as I could take. And the steps are measured with a little machine and the distance and that kind of thing, so that there's a feeling of having a goal and of meeting the goal. And we went through a lot of what is it that I cannot do. Putting on socks and shoes was agony for me before I took this program. Now it's not difficult at all. It's very easy to put on shoes. I was taught all kinds of ways in which I could improve in the kitchen, and improve in trying to put all of my clothes on, improve in how to get in and out of a car without difficulty. Those kinds of exercises became incorporated into my everyday living, and they became very useful to me. And that's why I've enjoyed the program so much, because my whole life has been improved by it, everything I do.
My best way to try to describe it is things like doing lunges, like forward lunges, side lunges, even back lunges, but things where you're incorporating your arm, like big arms, as well as big leg movements. It's a lot of things like trunk rotational exercises where, you know, like the palms are up and where they're actually having to, you know, turn, but this isn't standing, you know, but turning at their body, turning at their head. But like I said, big arms, big leg movements, trunk rotational movements, actually quite challenging, you know, and then also incorporating some of the coordination efforts to where in the middle of these exercises they're doing things like opening, closing their hands, and they're having to count out loud, you know, how many repetitions they've done. So it's very physical, but it's also cognitive of having to keep track of their repetitions and the order of their exercises.
Most of us believe that our bodies are just there and they'll be useful all of our lives. We don't even think about it when we walk. We don't think about it when we talk. All of those activities are done spontaneously and simultaneously once we become 18 months old. From there until the time one is diagnosed with Parkinson's, you forget about all of that. You just do it. Once you have Parkinson's, you realize that your body is not going to do what it used to do, and you have to retrain the brain to do those activities. But it takes the effort, and that's something that was mentioned every single time I came in here under the Loud and the Big program. How much effort am I putting into it? The greater the effort, the more improvement and the better the life. So I'm highly enthusiastic about this program.
What we found is by using this LSVT Big program is by kind of almost exaggerating the movements of where, you know, the exercises where they use bigger, more effort movement patterns. It actually followed into where their daily living skills improved. You know, they actually were able to get dressed in a shorter amount of time, were able to stand up and take a shower and not be at risk for falling as they may have been before.
I'm always impressed with the staff at Touro, and these particular therapists are excellent at what they do. They're enthusiastic. The program is such that you feel like you're playing rather than working, that you're not exercising but you're having a good time. I can't encourage people enough to come and see how this program works and how enthusiastic the staff is. In fact, when I started the program and they had just finished their training, they were all laughing and exercising with me and just enjoying everything about it and seeing the difference in the improvement in the patient.